Thank you for joining us today on the program Healthy Living. I'm Adesuwa Osa-Uwage. It is no longer news that the coronavirus is ravaging so many countries. And it's quite unfortunate that in so many parts of our state and other states, a lot of persons have thrown caution to the wind. You know, people don't really have regard for the COVID-19 protocols that have been put in place by both state and federal government. Move around the cities, you find that only a handful of persons are wearing their nose mask or face masks, as the case may be. And some others do not think it is important, particularly when they are in public places. A discussion with somebody yesterday revealed the fact that even some churches have stopped using face masks. They don't have any regard for it anymore. You could just walk into church and nothing will happen and nobody will disturb you, nobody will talk to you. But if you are going for any private or public gatherings as the case may be, please use your face mask. If you're not too sure, Google, and Google will tell you what is happening in India. Or listen to news, watch news, and you will know what is happening world over. Canada is another country that is having serious battle with COVID-19. The US is also having serious battle with COVID-19. UK just came out of a lockdown just before Easter. And some other countries are going to be on lockdown. And this will affect us economically, socially, and of course, those of us who like fun things, you will not be able to go out to have fun. Economically, companies will go on lockdown, industries will be shut down, nothing will be manufactured because everybody will be at home, and that is going to create serious problem in the economic sector, because when there is no manufacturing of any products, when there is no a company or establishment that is open, you see that people will suffer. Farmers won't be able to go about their businesses to produce food for you and I to consume. And when that happens, there's going to be food shortage. Okay, there's going to be food insecurity. Then the normal insecurity that you and I are experiencing will increase, because not everybody will have money to spend. All right, so let's put our acts well so that we'll be able to surmount this COVID-19 pandemic. If we surmount it, you and I will be happy. Our kids can't go out freely anymore. Go to parties these days, everybody is just carefree. You don't see people carrying their hand sanitizers anymore. You don't see people washing their hands. It's very important that you wash your hands with soap under running water. People don't take that into consideration anymore. Wash your hands. When you're going out, you wash your hands. When you come into your house, wash your hands. The clothes you're wearing, please take them off and wash them. Don't wear shoes into your homes, because from sputum, you can pick this thing with your shoes and take it home. It kills so fast. And if you have a very severe case, it can damage the lungs, the kidneys, the liver. And when you begin to have issues with all of this, tell me, where are you going to run to? Even the India that a lot of persons run to for medical treatment, you know, it was like a maker of some sort for some persons. Oh, we're running to India for this, that. You can't even go there. You can't go there, okay? So let's take all of these very simple precautionary measures seriously. Wash your hands. Use your nose mask when you're in public. Okay, use your hand sanitizers. Protect your children. You find some parents will wear face masks and then their children will go face bare on the streets, and it begins to happen. What is this parent up to? Keep your little ones, your infants, keep them at home. Get somebody to look after them when you're going to the market or somewhere. Let's save our kids, okay? If we do all of these things, it will be better for us. The kids are on holiday and they are resuming next week. The holiday is quite short. Some are even in school. Teach them over and over again on how to protect themselves. If we do this, the world will be a better place for you and I. Coronavirus is here with us. Even with the vaccination, you can still not be too careful. Some of us have taken the vaccine, others don't want to take, others are still waiting to see what will happen to those who have taken the shot already before they get convinced that, okay, let's do this or let's not do this. If you have underlying ailment, ask your doctor before you take the vaccines, okay? The Johnson & Johnson is once again recommended for people to use. At a time, it was said that it causes clotting of the blood. But some have said that research have shown that it's just in remote cases, okay? So whatever vaccines, be sure that it is the original vaccine, because we're hearing stories that a lot of makey fake abound now. But well, we're trying to protect the nation, and so those at the borders are doing everything they can to make sure that this is checked. All right, today on the program Healthy Living, we want to look at alternative to natural conception. A lot of women do have problems conceiving. Not their fault though. 1, 2, 3, or 4, or several reasons may be why this is difficult. And most of the time, the woman is quickly to be blamed for inability to conceive, forgetting the fact that it takes two to tangle. We have heard from doctors that 40% of the problem is with the woman, the other 40 with the man, and then 20 nature. It does happen. So we have a doctor in the house, is a familiar face, who's going to be discussing this with us. This and many more on the program. And of course, you can call in to ask your questions on what we are discussing today, okay? Just the topic, anything that has to do with gynecological issue. I don't know if it is the environment or if it's what we eat, if it's our gene that is causing all of this, but whatever the problem is, Dr. Steve Ogboma, who is a consultant obstetrician and gynecologist, is in the house and is going to be talking to us today on this topic. Dr. Steve, it's nice to have you on the program.
Thank you very much.
Okay. All right, last week we tried talking via Zoom, but the network was very terrible.
It was easy. It was not dependable.
Yes, but thank God you could make it to the studios today for us to talk. All right, doctor, let's quickly do this. If we're talking about alternative way of conceiving, what are we looking at?
Well, the word alternative.
Yes.
That's the answer to the question.
Alternative
to natural conception. So you are looking at all other methods to one side compared to the natural conception. The gold standard in alternative methods of conception is in vitro fertilization and embryo transfer. When we use that word, we are very specific that it has to be, conception outside the body, and subsequently the embryo is transferred. But there is a misnomer in the usage of the word IVF and the use of the word assisted conception. Assisted conception implies all other conceptions that are assisted by man or woman, to ensure a successful conception.
Which include?
Quite a number of them. For example, IVF is one. Number two, what we refer to as insemination is quite common because it's a cheaper method of conception. Insemination simply implies obtaining spermatozoa, treating it, and inseminating it into the woman using a tube at the peri-ovulatory period. If it's time, when we do the process of follicular tracking, we monitor the human oocyte on the ovary until it's about to rupture, about 20 to 22 mm stage, then you do a transfer. The conception rate is about 10%. That is, if you do 10, one of them will be successful.
One of them.
Unlike IVF, which I refer to as the gold standard, if you do 100, you are looking at 34% of them getting pregnant. So it's a more reliable method.
The
And,
IVF.
yes, but it's more expensive, and it has other side effects that are associated with it, which other methods are not associated with. There are methods that were used in the past we call gift garment fallopian tube transfer, when you obtain the garment, laparoscopically, and insert it into the fallopian tube with the with the spermatozoa, and hope for fertilization. That is, it's still in the natural environment, but the movement of the spermatozoa didn't get there naturally. It was placed there. And the human oocyte also was placed at the same point where fertilization can occur. Other methods where, the cause of the cause of the subfertility, I will not use the word infertility because technically nobody is infertile until you investigate and determine that you have not been able to find a cause for the infertility. So you refer to it as subfertility. But there are situations where, someone, a couple has not been able to achieve a pregnancy. But when you investigate them thoroughly with modern methods of investigation, you will not detect any pathology. So you refer to it as unknown case of infertility. You don't know the cause. The cause is unknown. But we do know that scientifically, if you have 100 women, getting them ready for they're having regular sexual relationship to achieve a conception, only 84 of them at the end of the year, 12 calendar month, will be pregnant. The 16% will not be pregnant, but you will not find the cause. That is nature for you. All right. So some people believe that there are other factors that are associated with, conception. It's a gift from God, your ability to achieve a pregnancy, because quite a lot of people do it, and they are well, and they are healthy. Their husbands are healthy, the females are healthy, but they do not achieve a pregnancy. And when you thoroughly investigate them, you do not find any pathology. Okay. So, having said that, IVF, we say, is gold standard, but it has some baggage in terms of cost, in terms of the side effects. Quite a lot of side effects associated with in vitro fertilization and embryo transfer, especially during the stimulation period, when you give the woman drugs to make her produce more eggs. You don't want to be hoping for just one human oocyte. You want 20, 15 and above. And this is a stress and strain on the mother's hormonal milieu. And this can go haywire, and she can end up with serious medical issues, like excessive production of fluid leading to ascites, and we'll call it a particular syndrome, which I won't want to bother you with. So those are side effects. And sometimes blood clot formation occurs that can kill the woman. Clotting that can happen in the level of the heart, in the brain, in the smaller blood vessels, thrombosis, some of these organs, and can take the life of the baby. Even after the embryo transfer has been successful, and you are monitoring the woman in the first few weeks, first few weeks, 6 weeks, 8 weeks, 10 weeks, then you can have all these complications, and that can, in certain situations, if not properly managed, it can be fatal. But if you detect the problem prior to embryo transfer, then you defer the transfer of the embryo and do what we call coasting. You just watch until you feel it's appropriate, to transfer the embryo. I mentioned briefly, genital insemination, but the other methods of assisting a woman to achieve a pregnancy is the use of gonadotrophins. All you are doing is that you have assessed the woman, the tubes are patent, your husband's seminal fluid analysis is normal. Normal in the terms of movement, of the ability of the spermatozoa to move, the movement should be vigorous enough to be able to penetrate the human egg,
yes,
and fertilize it. Okay, that's movement. The number should be adequate, at least more than 20 million, but you just need one spermatozoa to go in and score the goal. But, you have to have a lot, so that one can be successful. So the ability to move, the morphology, are they normal? Do they have one head, two heads, three heads, or two tails, as the case may be, in which case they will not be able to fertilize the human oocyte. So all these are problems that are coming from the male side. And the ability to ejaculate and put the spermatozoa where it's supposed to be may be lacking. So if you now assist that man to take the spermatozoa from where it is and place it in the correct place, it's a form of assisted reproduction.
Yes.
You are helping. So it's an alternative method of doing it naturally. So there are other methods. There are other things the urologists can do. Sometimes somebody has surgery when he was very young, then they truncated or they cut the vas deferens, then there might be accumulation of spermatozoa that is produced from the testis in a sac, within the vas deferens, which you can put a 23 or 25 gene into and aspirate, and look at it under the microscope, clean it, wash it, and transfer it. So all these are all possibilities that we can use to help women who have not been able to achieve pregnancy. So ovulation induction is there. What is popular here is the use of clomiphene citrate, but gonadotropins are better, but they are more associated with side effects. For those who know how, those are better drugs, to use. Then sometimes medical treatment is not helpful. You require surgical intervention. The commonest problem in this part of the world is a high rate of backstreet, termination of pregnancies. When these are done, it's associated with infection in the fallopian tubes, infection in the pelvis, the peritoneum of the pelvis. They adhere to each other. So adhesion can be in the uterus, which we call uterine synecdoche, and when that happens, then a human oocyte, a fertilized embryo cannot express itself and grow.
In such an environment.
It's like, a seed planted on stone. It will not survive. Okay. You now look at the other part of the peritoneum. For example, the tubes are blocked. So the tubes are blocked. Then you check it. The commonest way of doing it in Benin is HSG. But there are other methods of determining the nature of the fallopian tube patency, which we call hycose. So you can do that, all that ultrasound scan guidance, and see it if actually it is opened. Because, the spasm of the oviduct, that is fallopian tubes, can complicate, the results of the process. So in certain situations, the tubes are open, there's spasm, then it is recorded as blocked. So that woman will carry this stigma for all her life. But if you use the other method, that cannot occur. So those are the things that can be done. When surgery, laparoscopic surgery can be used to release adhesion. Sometimes infection in the pelvis binds down the ovary. So when the ovary releases egg, it's trapped in adhesion. So through laparoscopic surgery, you can release all these adhesions so that the egg can be taken by the fimbral end of the oviduct and taken through to the ampullary region where fertilization takes place. So all these things are quite possible. So it is not only IVF.
Okay.
Yeah, people need thorough investigation to ensure that they are able to determine the cause of the problem.
Yes.
That is the major thing. Once you are able to determine the cause of the subfertility, you can manage it. Although there are situations where you cannot manage it.
Okay.
For example, when a man is completely azoospermic, it's not producing, was born like that, it's not producing spermatozoa.
Is it possible?
Yes.
For a man not to be born. Without producing spermatozoa. Is it possible?
Yeah, it's possible. It's possible. So
how is such a man supposed to know? Is it self-diagnosed?
Well, when he's growing up, that individual, because the testicle will produce the male hormone, the testosterone. So he may not do things like his mates, his peers. He may not grow a beard because he's not producing the male hormone. He may not grow pubic hair because he's not producing the male hormone. The hair may not recede because he's not having the male hormone. And in addition, the voice changes associated with the male may not happen because that man is not producing the male hormone. When you see them, they have very typical feature, very girly-like. When people used to say, it looks as if somebody does not have joints. They look, will I say, pretty, but they are males, but they look more like females. They lack male hormones, and when you carry out
is there hope for such a person? Maybe surgically, medically?
Yeah, they can be treated. Yeah, what is missing is the hormone, you replace it. So hormone replacement therapy. Just like in the female, when they are post-menopause, we give them HRT and they feel young again. So all these things can be manipulated.
And these hormones, are they not cancerous? Because we've heard often a time people say that, okay, like in that of when a woman has reached menopause and you want her to feel young and get all those hormones again. We've heard from several quarters that that particular hormone is cancerous.
Yeah, it's estrogen. Estrogen. You can't say estrogen is cancerous because millions and millions of women are using it, in America, in Europe, and it's quite effective. These are drugs that have been used, since 1970. All right. There is a high incidence, in terms of the relationship between these hormones and breast cancer and cardiac problems. And they did a 1 million women research that was carried out in the US, and it was not very definitive that, there is a causal relationship between breast cancer and hormone estrogen. But what we do because of medical legal issues is to sit such women down and explain the pros and cons and allow the woman to make the decision. If the woman who wants HRT, hormone replacement therapy, decides to go along and have the hormone, fair enough. If on the other hand, she decides against it, it's also fair enough. So you allow her to make the decision so that if whatever happens, you are in the clear. Because you have given the pros and the cons of the treatment.
Okay.
Yeah.
All right. It's Healthy Living on ITV, and we're looking at helping you get pregnant, and to make you happy. Some persons cannot conceive naturally. And if you go to the hospital, like doctor said, they may not find anything wrong. I've heard women say that, oh, I've done all the tests they need to do, and then the doctor said nothing is, so what could be the problem? You can call in now to ask Dr. Steve some questions so that you get answers to your questions and then get a direction on where to go. The number is 052-290-573. Is our usual number. It has not changed yet. 052-290-573. Please call in to ask questions. You may have quite a number of questions to ask. It's better you ask a professional than asking those who do not even know what to do with you, okay? Ask a question. You don't have to say everything now. Just ask basic questions and Dr. Steve will give you an answer. All right, Doc, we're looking at the issue of a sperm donor, egg donor, and all of that. How does that work?
Well, it works. It works. Donation goes back to late 80s, and it has helped.
Is it legal in Nigeria?
Yeah. Well, I know everything about the HFEA, that's Human Fertility and Biology Authority of the United Kingdom. I know that colleagues are doing them in Abuja. So I think it's legal. It's legal. Embryo, you know, that's garment donation is legal.
So who are those that should look for these options, like egg donation?
Like we just mentioned one, someone who's a zoospermic, you know, has the woman and the man can agree, you know, to obtain, you know, spermatozoa from a donor, usually medical students, and they are not, it's not to be sold, so we give them a token for transport so that they come and give the specimen.
Okay.
So they do typing. Such women who takes, who have such garments donated are protected from infections because they are the men that come to donate spermatozoa. They are screened for infections.
Okay.
You know, HIV, you know, tuberculosis, VDR, syphilis, and things like that. Then hepatitis A, B, C, and all. They are screened for all these diseases to ensure. And sometimes you take the race, the white bloke to donate for the white girl, and the black bloke to donate for the blacks. And in terms of height, you also monitor them for height, for weight, for intelligence. You know, you monitor all this before you choose a donor for a particular person. Those who are more learned, and they give you the type of donor they want. They cannot say the donor because it's hidden. The donor must not know the recipient because of the medical legal issue associated with it, so that the man cannot come and claim the child or sue to claim the child in the future. So he can never know where his donated spermatozoa goes. So the semen sample is obtained, is cleaned, and at the appropriate time, it's used for IVF or, you know, intrauterine insemination. In certain situations, it works out. Sometimes they fertilize about 10 eggs. They are frozen, you know, for subsequent cycles. So in every cycle, you pick the two best embryos and transfer, so that the woman will have a better chance of having conception. So all these are done. Similarly, a female can donate a human oocyte, you know, to another woman. It can be from the same lineage, a junior sister donating to the senior sister. A friend, a close friend, who is very understanding, can donate. But she will have to sign an undertaking that after the child is born, she will not come and claim. She lay
no claims on that child. Okay.
You know, she must sign such undertaking, and they'll make sure she said it. And there can be complications, you know, from overstimulation of the ovaries, leading to hyperstimulation syndrome, complications like thrombosis. All this can happen. Complications associated with pregnancy that can end up in surgical delivery with either a forceps delivery from below or a cesarean section. All these are possibilities. But she's made aware of all this.
Of all of this.
Then there is another option where you have a surrogate. You know, you are able to produce an egg, but maybe you don't have a uterus, or you have a uterus that lacks the capacity to carry pregnancy. So the surrogate can help you to carry the pregnancy. We also sign an undertaking that she will not take the baby from you at the end. All these are done. These are legal things. They involve going to the solicitor's office and getting all this done. Or the solicitor is invited to the clinic, you know, to monitor and explain every line of the agreement. And at the end, hopefully, the individual may get a pregnancy, or she may not get a pregnancy. But most of the time, those who persist in trying to achieve a conception almost always achieve a conception. because God is very caring. When he see you have suffered enough,
Yes.
he will open his hand and give you what you want. Yes.
Okay, we'll pray so for so many women out there who are actually looking for. Now, Dr. Steve, let's look at getting pregnant after a fibroid operation or ovarian cyst. Talk to us about ovarian cyst and fibroid, how it disturbs pregnancy.
Well, ovarian cyst is just an unusual or abnormal swelling, a cystic change on the ovary. Normally, the cysts are formed during this cycle. That's the menstrual cycle. Little cysts are formed, and the human oocytes also grow. They are recruited maybe 20, 30, but only 1 or 2 will get to maturity. And in the same time, there are other cysts, physiological cysts, we call them, also grow. But sometimes these physiological cysts persist and grow to become a permanent feature of the ovary. Some of them are small and they are ignored. Some of them become very large. There are various types of cysts. Some of them carry the products of human hair, teeth, and all that. We call them dermal cysts in the ovary, because they are totipotent cells. They have the capacity to differentiate into any part of the body. They can form cartilage, hair, teeth, and neural tissues. So, such cysts will be required to be removed. But science now, based on laparoscopic surgery, they can be cleanly taken out, and the ovary repaired to reduce adhesions. And there are solutions that we instill into the peritoneal cavity to minimize adhesions after these operative procedures. So quite a lot of them, of these cysts, can be dealt with. But after that, those cysts go on to produce the human oocyte, and the women can get a pregnancy. But if it's poorly done, if the procedure is poorly done, there are a lot of adhesion. The person may not be able to produce a human oocyte. She may produce, but the eggs are not released from the ovary. Because they are not released, they cannot get fertilized. And because they are not fertilized human oocyte, conception cannot take place. So all these type of thing happens.
And that's a fibroid.
In the case of the fibroid, well, it depends on who is doing the fibroid. Fibroid operation can be easily done because the fibroid that involves, you shell them out with minimal distortion of the uterus, so long as the fibroid does not extend into the endometrial cavity. Where the baby sits, because fibroid can be an endometrial fibroid, it can be within the muscle we call myometra, and it can be on the surface. This is serosa kind of fibroid. So these 3 types. If you have the one that is on the surface, you can easily pluck it off and no problem. Even if you have the one within the muscle of the uterus, you can take it out, so long the integrity of the endometrial cavity is not compromised. But if you have that one that projects into the endometrial cavity, then you can do it from below, hysteroscopically. You look at it, it magnifies it about 20 times, then you carefully shave it, layer by layer by layer. You are not in a hurry, because
you're just taking your time.
You
to
take
do a
your
good
time,
job.
you shave it off, using some, little very effective instruments, and that's it. And some of them, there is the growth of the endometrial lining over that portion that has been shaved takes place, and with that, the woman can achieve a pregnancy. So fibroid, after fibroid, you can have a pregnancy, definitely.
But there are some persons that think that they can use drugs to melt the fibroid.
Yeah, they were drugs.
Is it possible?
Yeah, they were drugs. They were drugs produced from a very popular pharmaceutical company. I don't want to mention name.
You don't have to.
And this drug was quite effective, but due to its effectivity, it does not only attack the fibroid in the uterus, it also attacked the liver cells. Because of that, a lot of people are having complications of liver pathology, and on the basis of that, the drug was withdrawn from the market. So the drug was quite effective. It could reduce the size of the fibroid by 20%, but it has been withdrawn. At least in England, I'm very sure of that.
But today, if you go on social media, you see quite a number of drugs, number of supplements, you name it, up to herbal remedies for fibroid. They tell you you don't have to go for surgery. All these drugs will shrink the fibroid. All this medicine would, in fact, the fibroid will melt out from the woman, and you begin to. And a lot of women are like keen into that.
No, the fibroid does not melt.
It does not melt.
No, fibroid is estrogen dependent. After the menopause, the fibroid will shrink, but it does not disappear. Okay, if you use drug that challenges the estrogen, the fibroid will reduce in size, but it does not melt out.
Okay.
Yeah,
please hear that. It does not melt.
It does not ever melt. Once the fibroid is in the uterus, it will continue to be in the uterus. Even if you, whatever drug you give, anti-estrogenic agent, it will shrink it.
But after surgery, does it not disappear?
Well, you see, you cannot remove all the fibroids. As you are having a big fibroid here, you are having a minuscule fibroid there. So that the big one they are removed, because the person is responding to estrogenic effect, the little ones will also grow. So,
okay, let's quickly take this call. Hello, caller. Good afternoon. Hello. Good afternoon. Please tell us your name and ask your question. Okay.
Please, I have this issue of so I'm complaining to doctor before.
You have issue of what?
The issue is that I conceived August last year. So when I registered for antenatal, they asked me to do a scan. So scan gave me date of delivery at the 25th of April. That is last month. Till now, but I'm getting the sign of labor, but nothing is happening. I don't know if there is anything wrong.
Okay, you got that.
But last week here, my doctor asked me to do another scan. The scan said the 7th of this month. I don't know if there's anything wrong with the baby.
Okay, does your baby kick?
Very well.
Okay. Well, you see, if you do a scan very late in pregnancy, it can never give you the correct, gestational age. The best time to do a scan to assess the gestational age and determine the expected date of delivery is very early in pregnancy. In fact, before the 16th week. So you go for a dating scan. A dating scan, number one, to determine viability. Is the pregnancy there and is it normal? Then from there they can calculate when you are going your expected date of delivery. So if you do a scan, maybe you are already 30-something weeks, it can never be accurate. So what time they give you will not be accurate. But generally, there is a time limit the baby would stay in the womb. Naturally, labor would start spontaneously, even without using any medication. But if your obstetrician understands based on the age, because 37 completed weeks is when term starts, up to 42 weeks. So during this period, the person should be, your obstetrician should be alarmed enough to intervene and, start the process of labor off by induction of labor and you getting into labor and delivering the baby.
Okay.
All right.
All right. I hope you got that right, madam. 052-290-573 is the number. It's right there on your screen. And when you are calling, do us a favor. Reduce the audio level on your television set so that we can communicate effectively. Hello, caller. Good afternoon. Hello, good afternoon. Hello. I just said you should reduce the audio level on your television set.
Okay.
Are we good now? You still have to reduce the audio level, please. All right, when you're calling, reduce the audio level on your television set or move away from where your TV is. Hello?
Good afternoon, ma'am.
Good afternoon. Please talk to us. What's your name?
Faith. My name is Faith.
Okay, go ahead. Sake.
Okay. I had a fibroid operation
Okay.
in 1996, and my womb came out after 5 years. Now I want to check with the doctor on the possibility of having children, and I also want to have the doctor's number so that I can contact the doctor and go and see him. Thank you, ma'am.
Okay, how old are you? Hello? Okay, the caller is gone. You wait till the end of the program. I will call a number that you can reach us with immediately after the program. For all those who are also having issues, particularly male, who are having issues with, having to do with sex and all of that, because on radio last week, a lot of persons did call that they are finding it so difficult to have intimate relationship with women, for several reasons. It's your chance to call into the program because doctor is going to do free advice on air now. So call us and let us talk. Hello, caller. Good afternoon.
Hello?
Hello, good afternoon.
Hello?
Hello, I can hear you. What's your name?
My name is Naomi Osinde.
Okay, go ahead with your question.
Please, I want to ask the caller that I know somebody that has fibroids, and the thing is very big. What can the person do? And the doctor says it's an operation. Is there anything the person can do?
Aside operation. You know of somebody who has fibroids and doctor says is operation, if there's anything the person can do apart from operation, why are you scared of operation? Okay. All right, doc.
Well, if you want to remove the fibroid, you have to have a myomectomy, which is surgery to remove fibroid. But if you want to shrink it a little bit, we can give you drugs to shrink it. It will reduce the size by about 20%. But the fibroid can never disappear. So that's the best on offer. We can shrink it with tablets or with injections. That is anti-estrogen, but the fibroid can never disappear.
Okay, you hold on to the end of the program. We'll roll out a number for you, okay? 052290 is the number. We've got just barely 5 minutes. Hello, caller.
Hello?
Yeah, good afternoon. What's the name, please?
Good afternoon. My name is Vera.
Okay. Reduce the audio level on your television set.
Okay. I have a fibroid.
How do you know that you have fibroid?
I've went to scan.
Okay. Your TV is too loud though. Your television, the audio on your TV is too loud. Okay. Hello?
And I went for scan.
Okay.
They said it's fibroid. And then now, if I press my tummy, the thing is paining me.
If you touch your tummy, it will be paining you.
Yes.
Okay. So you want the doctor to talk to you about that, yeah?
Okay.
All right, doc.
Yeah, you can have pain if you have a fibroid, because fibroid can undergo various degeneration. Sometimes there is too much of blood going into the fibroid, and that can create a lot of pain. So we call it red degeneration. Fibroid can undergo necrosis because it grows so much, it cuts off the blood supply. And when there is no blood supply, then the tissue becomes necrotic. And that can reduce the size, but it can create problem. If the necrotic tissue is infected, then the infection will be very violent. So fibroid can cause pain, definitely. The pressure symptoms on the bladder can be problematic. And the pressure symptoms on the veins coming from the lower legs can end up in varicosity that can be disfiguring and be associated with pain. So it depends on the fibroid. Very huge fibroid, like a pot, have been removed from some women. Sometimes, you can just have the fibroid the size of a ripe mango, or maybe bigger than that. So fibroid can be of various sizes. It depends on how fastidious the patient is. Once a scan is done, and some women know they have a fibroid, even if it's 1 centimeter, they want it out, which can be burnt through the laparoscope. But there are those who have one the diameter is as wide as a ruler, 12 inches. But they just prod on and carry on with life without doing anything. So that is the way. We are all different. And our response to disease conditions also differs.
All right, we'll take the last call now. Hello, caller. Good afternoon. Please reduce the audio level on your TV. Good afternoon.
Please, ma'am, I wanted to ask if there any injection for erectile dysfunction for the friend of mine.
If there is any injection for erectile dysfunction, Doc, is there any kind of injection for erectile dysfunction?
But I cannot say it's an injection. No, there's something you swallow, but you can have some injection. Yes.
Okay.
Yes, I think I will end it there.
Okay, you can have some injections. You can have some tablets. It is manageable.
Yes.
Okay, so tell your friend to see a doctor. All right.
But also, you can just have a session with a specialist.
Okay.
You just talk to you and explain things to you, and you become well if you practice certain things that you are told to practice. So it's part of psychosexual counseling.
All right. Well, we should be able to have that section on the program, Healthy Living, where we'll talk about all this. We'll give it like 5-10 minutes, and then we'll see how we can use that to help people out there who seem to have this problem. But unfortunately, many of them will not come up because of stigmatization. But we shall create some kind of privacy for you so that you can talk to a doctor and talk to a therapist. We need you to be happy. All right, guys, this is all we may be doing today, or all that we're going to be doing today on the program. Dr. Steve, it was a pleasure talking with you today again on the program. All right, for those of you who are looking for numbers to reach us with, please call 070-550-71439. The number again is 070-550-71439. Do call that number immediately after the program, and maybe subsequently if you need to get answers to anything that have to do with gynecological issue. My name is Adisuwel Sawagie, and we'll see you again on Monday. Bye-bye.